What we know in the cardiology literature to date is that South Asian patients have a high burden of coronary artery disease. They often present 6 to 10 years earlier with their first heart attack and tend to have a poor outcome with respect to survival. But the question in my mind was, we tend to always focus on hard endpoints like survival, but what would the quality of life be in a South Asian patient with coronary disease? What we used was a questionnaire called the Seattle Angina Questionnaire, which is well known in the cardiology literature to assess quality of life and functional outcomes in patients with coronary disease. So using this questionnaire out to 1 year, we found that South Asian patients, their mean, adjusted mean score with regards to anginal frequency, treatment satisfaction, quality of life, and exertional capacity was significantly lower in the South Asian Canadian with coronary disease compared to the European Canadian with coronary heart disease. And so to me what that meant was that the South Asian patient diagnosed with coronary disease tends to have chest pain more often, and because of that it limits their exercise capacity, and because of all of this they're not satisfied with their treatment or their current therapy, and this has implications with regards to their poor overall quality of life.
My name is Laksiri Gunawardena. In 2005 I had a heart attack and I phoned 911, taken to Grey Nuns in the ambulance, whisked into emergency, and I had my heart attack actually in the emergency room, and they had to put the pedals and revive my heart 3 times. It would have been a shock before I had my heart attack, but subsequently I got to know from my doctors and talking to other Southeast Asians that the prevalence of heart disease is more common among Southeast Asians. And so I'm kind of aware of it now.
As a physician, to me what this means is that we need to pay closer attention to these patients or be more vigilant in regards to their pharmacologic as well as non-pharmacologic therapy in order to try and improve their functional outcomes.
I think he's doing a fantastic job, and I think not only to make people aware, but changing their lifestyle and eating habits even before they get these heart attacks, it would be a wise thing to do. That's in my opinion.